Generally, when I'm describing the vascular system, I like to think of it more like plumbing. All the same kind of plumbing disasters that you have going on in your house, you can have going on in your body, and that's what we fix. Hello, I'm Dr. Jason Conner. I'm a vascular surgeon with MedStar Health. I love vascular surgery. I like how the blood vessels work and how they get blood down to the leg and how we can manipulate that to make folks better. The disease process I enjoy most in vascular surgery is the treatment of peripheral vascular disease. Peripheral vascular disease is basically plaque buildup in your arteries that can lead to a narrowing or blockage, which decreases blood flow generally down your leg, so kind of from the belly button down. And this can lead to issues with walking where you have pain when you walk. It can also lead to sores or ulcerations on your feet, or if you already have those sores, it can lead to a decrease healing rate of those ulcerations, which could eventually lead to things like limb loss. The main things that lead you to have peripheral vascular disease or put you at risk of it are things such as diabetes, heart disease, tobacco abuse, a family history, high blood pressure, and high cholesterol. At MedStar Health, we have a rather large vascular team, and so it starts in our clinic, where you'll see one of the vascular surgeons, myself included, and then we have vascular techs there that will help us evaluate your arteries utilizing ultrasound, so non-invasive testing, and they can tell us where the blockages are, if there are any. One of my favorite procedures to treat peripheral vascular disease is actually lower extremity angiography. And what this is it's a minimally invasive way to evaluate the blood vessels to the legs and then treat those blockages or narrowings. The reason I love this procedure is because if it's done well, a patient can come in the morning and not be able to walk more than a block without having pain, and then leave in the afternoon being able to walk as far as they want without having any discomfort. I also really enjoy the fact that it's minimally invasive, so we can do it all through a needle stick. There's no big open surgeries, and I really do feel that the patients get a lot of benefit from this procedure. So if I had to pick one that I like for peripheral vascular disease in particular, I would say it's lower extremity angiography or angiograms. You know, one of the greatest parts of a vascular surgery is that it's ever-changing. The technology and innovation is continuing to move forward at a rapid pace. And so we're able to do things now that we weren't able to do even 5 years ago. We have a lot of patients that they're just normal folks that are trying to feel better. And usually when they come to see me, they have something that is going on generally with their legs that nobody has really been able to tell them what it is. And a lot of times we as vascular surgeons are able to tell them what it is and help them with that and get them to a point where they feel better.